Okay, so I want to go and right into it. And first of all, I want to see, what do you expect? What can you expect from an NBME exam, right? I have just found out that your final exam will be 160 questions. You will see a bunch of different approaches of how they ask you about the um, subjects and the material that you've been learning this semester, okay? This is not a comprehensive list, okay? But you will may find on these exams, on these questions, you find short question stamps that you may, the natural response is to say, wait, there's not enough information here for me to answer these questions, right? But I see that a lot, especially on people doing a lot of these questions, that when they're studying with UWorld, they go back and do NBMEs. The NBME questions tend to be a little shorter, even though they are getting a little longer now with the new NBMEs. But for you, you don't know yet what to expect. This is your first one, and you want to be exposed to as many questions as you can so you can get familiarized with this, the format. Okay, so you may have short stamps, like we said. You can have long question stamps, right? You can get confused. They can throw in some lab values. They can throw in some graphs. They know that graphs confuse students. They can put in images that may confuse you. You've never seen before. You don't know what it is. You can't recognize the structures, right? You have to be exposed so you are prepared, right? They can throw you some X-rays, some CT scans, some MRIs, even some ultrasound, okay? You may see questions that have confusing answer choices, right? You see those up and down arrows. They have multiple systems being involved. They're going up and going down, and it's super confusing. Added with a long question stem, people run out of time and they end up just guessing. So you have to have a strategy to get through these, okay? And they may give you an answer, a question that may have a really long answer choice, and there's 6 of them that you have to read the whole thing and make a decision in a minute and a half, right? So you have to do them. Like, keep repeating this. You have to start doing questions, and a lot of them, right? You may find unfamiliar vocabulary, right? You may see where, especially at your level, your first semester, you have not learned all the the vocabulary, the medical, terms, and the USMLE questions are made for people that are done with the basic sciences, basically. So you have to keep in mind that there might be some words in there you don't recognize, but you will go over a strategy that can make you be prepared and know what to do when that appears, okay? So when people, let's go over to the next slide. But what do you expect from an NBME test, right? You have to have an approach, right? You can't just go in and pretend that all you need to do is memorize the material. Great, if you have a photographic memory, then yes, do that by all means. But for the rest of us, you should have start to develop an approach to get to all these questions, okay? Some of these questions will ask you different, like similar, they will ask you different things at the end of the questions, right? What's the pathophysiology of whatever condition they talked about? What's the mode of inheritance, right? What's the enzyme involved? What's the mechanism of the disease? This disease that we talked about, what is this similar to which other disease, right? They can throw you anything, right, at the end of that question stem, right? They can ask you what additional finding of the physical exam, right? They give you some disease, they describe the case, and then they say, what are you supposed to get on the physical exam? Maybe they give you a couple. What else do you get, right? Is it a heart murmur? Is it an enlarged spleen or liver, right? You have to be ready. You need to know what they like to ask, what's more high yield, then you know what to focus your energy on, right? So they can ask you, given this treatment, they can tell you what the treatment was. Maybe it's a therapy session, whatever it is, some drug, some tests, some anything that they used in this patient. What is the adverse effect, right? Given this treatment, does this suppress the immune system and this person can get another disease, right? They can ask you anything, right? You have to have an approach, because a lot of people that I work with, they have not yet developed. They're studying for step 1, and I'm even seeing it at the level of step 2, right? At the end of third year of medical school, people have not found a way that works for every type of question, right? So try to, maybe this is not the way for you, but try to get something that works for you, because people become frustrated and they end up thinking that all they need to do is review more material, right? And that leads to a person getting ready for this exam, sitting for the exam and doing really poorly, even though they thought they prepared well. Well, because these questions are designed to be the best answer, right? It's not the correct answer at all the times. Maybe a little detail of the material to throw you off, right? So it is not all about what you know about the material, right? It's about, how do they ask me about this concept, right? You have to be good at start recognizing patterns of what they like to use, right? Maybe you're memorizing all these keywords that they're not going to be present at the questions. So become very good at recognizing the ways to pick the relevant information from within the question stem, especially if they're long, right? Some students are really good at this naturally, but some of us are not, like I wasn't. You have to put in the work to become better at it. It's a skill that you can learn, okay? So how can you approach these questions, right? This is how I approach the questions every time, and people I work with, your classmates, or even the people that are on the leave of absence studying for step one, I tell them the same thing. Who is here? Like, who presented for this? This question stem is asking about which patient, right? I don't care about the other patients. I don't care about the other questions, right? Clear your mind, focus on that one question. Well, who is here? Maybe it's a 45-year-old female, right? That's what I want to know right now, right? And why is she here for? Did she come in for what? Does she have a headache? Does she vomiting? Does she have no complaints and she just has a follow-up visit, right? So they will throw in some stuff in the middle of that question that if you know who you're talking about, you'll start learning about, which diseases are more prevalent on older population, 20s to 30-year-olds. So when you see the age and the sex and who it is, for example, older males are susceptible to cardiovascular diseases, right? Young females to autoimmune diseases, right? So when you memorize about those things, because when you read a 45-year-old woman with a headache, well, maybe she's like perimenopausal, right? She's getting to the end of the ovulation, and maybe those are, you can think, if she was 65, you wouldn't be considering this. But my point is, develop this so you can guide yourself when you start reading the rest of the question. So at the end, you know who the patient is, you know what they're here for, right? Now, what does this question want from me, right? Do they want a diagnosis? Do they want me to know what the treatment is? Did they give her a treatment and now there's an adverse effect? Maybe you can answer this question by only reading the last answer, the last question, and looking at the question, right? My point is, when you don't have an approach, you end up highlighting everything on the text, right? And the whole thing is yellow, and you don't even know what's important and what's not, right? If you take an approach that selectively make you think and disregard the extra information, you will get really good at doing this automatically, right? Some people use it, like I was saying, use the highlight too much. Now you should use the highlight to separate what's relevant. And how do you find what's relevant? Well, who is here? What's the chief complaint? What does the question want from me? And take a look at the answer choices. Anything that's outside that parameter may not be important, right? For some of the questions, right? You look at the questions and say, well, what do I know about this topic, before you freak out and say, well, I don't know what this is. Well, maybe you know some things, right? Take a look at the answer choices. Maybe there's some drugs in there you don't recognize, right? I'm talking about specifically about this NBME. This NBME is not made to be taken early like this. They will separate some questions that they think it's fair for you to take. But I have had the experience of they buying the package of questions that they don't have any control of what take questions out, because it gets graded comparing to the national average. So you might have some questions that you've never seen before, and it's important for you to know, right? If I don't know what this is, and I think I've done a pretty good job preparing, a lot of my classmates are not going to know it either. So don't let it hit you like this is absurd and there's no way I can know this. Pick an answer choice and move on, okay? Because that question is probably going to get thrown away, right? They can only test you at the level that you're currently at, right? So this approach is designed to take you from a place where you just have the normal top to bottom approach, where you read every question, every word before you get to the answers that you need to choose from. From here, you want to train yourself to see this important information. In the beginning, you can use it to highlight, but eventually you won't even need to highlight. Okay, and I don't know if you guys are young, but maybe you remember the movie Matrix, where the operator can look at the screen with all the code and he can see exactly what is, I have an image there. He can see exactly through these computer codes, only what he can see, right? He sees only what all the other information is irrelevant for him. Okay, so this is what you the approach. Get good at recognizing what's important and ignoring what's not. And eventually you want to be like this, right? You want to be able to see, not focus on the walls. All you want to know, well, there are 3 guys there I need to worry about, right? So this is the approach. So let's get to the first question. Okay, so so this is a very short question. The NBME does a lot of this. They put in a lot of short little questions, right? So approach the question and read it, right? Which of the following mechanism which of the following is the primary mechanism of DNA repair responsible for preventing radiation-induced damage in neighboring neurons? Okay, so we're talking about DNA repair mechanisms, right? I go down here. I mean, there's nothing to read here. This is it, right? But take a look at everything's about repair, right? It's different repair. This is a complete recall question. You either know it or you don't know it, okay? There's no way around it. If you memorize it, you will know it for a fact, but you have to be able to not sit there and wait for the answer to show in your brain all of a sudden, right? Because most of the times it's not going to happen. So pick an answer choice. If you don't know, excuse me, pick an answer choice and move on, right? If you don't know it, don't leave it blank, right? You might get it correct, right? So when a question is like this, it may be easier for you if you review this. If you did a good job, maybe you remember this, right? In this case, alternative D, it's the correct answer here. But what do? They throw in a long question stem, right? Right now you're confused. Now this is not, if you give this question, this first question to 100 people, I'm sure way more people will get it correct if you give it this question to, especially at the first semester level, okay? Because they're going to come here and see that it's a 54-year-old woman with breast cancer. It comes to the physician with redness and pain and breast cancer on the right breast. She has been undergoing ionizing radiation therapy daily for the last 2 weeks as adjuvant therapy with, and then you might find drugs that you don't even recognize. Paclitaxel, I mean, you may not know what that is. Trastuzumab, right, for estrogen receptor positive breast cancer. Remember, this is the same exact questions, right? Which of the following is the primary mechanism of DNA repair responsible for preventing radiation-induced damage in the neighboring neurons? Exactly the same question, right? Sometimes these questions are actually very common that you're able to answer the entire question just by reading the last question. So, I mean, sometimes, I mean, you will see this, but you may not see, you may have to go back and read more of it, right? Because I have an example after that we go over that. But, you know, here it gives you, you know, detailed information about the drugs, the type of cancer she's having, her social history. She works as a veterinarian. She's a former smoker, findings in a physical exam, everything, right? And you might be lost at this point. And by the time you get here, you don't even know what this is anymore, right? So have the same approach, right? Who is here, right? Why are they here for? 54-year-old woman with breast cancer, because she's here because of redness and pain in the right breast. Okay. Now, what does the question want from me? Well, she wants this. And at the point that I read this, if I did a good job reviewing, I might already know that the answer choice is D, right? So we might not even go back to, we might not even have to go back to review this. Okay. So either way, if you have enough time, go back and read, right? Read fast, go through this. Okay, there's nothing new there. That's all they want to know, right? Move on to the next question, because that's all they actually want to know. Okay, now looking at this next one, these questions are, some of them you won't recognize. You'll find physical exam results that you don't know what it is. Okay, for example, this question, but use the same approach, right? Highlight what you want. What do you know? It's a 65-year-old man, right? What are they here for? Just run your eyes through this. You got a minute and a half to read this, okay? They got worsening shortness of breath, productive cough, okay? And then what does this question want for me, right? The drug that most likely is most likely responsible for this patient's muscle weakness inhibits which of the following, okay? Well, let's take a look. This is not like that previous question that we're able to quickly know what it is just based on that last question. Well, they're talking about some muscle weakness here. I need to see what's going on. Well, go back and read it, right? This guy is a 65-year-old man. He has chronic COPD, and he's in the hospital. He's got worsening shortness of breath, productive cough. Maybe he has an infection, right? And they 3 weeks later, he complains of weaknesses in the lower limbs. And here, this might throw you off, right? Strength is 4 to 5 in the hips. I don't know what that means, right? By the way, the motor findings are reported in a 5 out of 5 scale, right? Being weak, 5 out of 5 is normal. And anything below there, it's about severity. If it goes 0 to 5, it's like completely paralysis. 4 to 5, a little bit of weaknesses. Okay. And whereas in reflexes, when they report deep tendon reflexes, we're 2+. So that means it's normal, right? So 2+ on the reflexes is normal. Anything above 2+, like a 3+, 4+, that's hyperreflexive, right? That is a finding of perhaps a upper motor neuron finding. They will report those findings as a 3+, 4+. If it's under, the reflexes are gone, such as in peripheral diabetes neuropathy, it will be understimulated, right? You hit one of the patella tendons, it goes normal. You hit the other one, it's like mild. So that finding will probably be reported as perhaps a 1+ or a 0, right? So depending on how severe it is. But don't get bogged down with these findings that you don't understand what it is. Just step back and say, well, what do I know about this? Okay, maybe you know these, you've just taken molecular biology. You're familiar with all these 5-lipoxygenase, maybe you're not, right? But you might get these questions that you've never seen before. If you have never seen before, pick an answer and move on. If you have, pick the right answer, process of elimination. If you're not 100% sure, well, try to get something that you are sure it's not the correct answer, right? Say, I'll take out A. Well, now it's 4 out of 5, 1 out of 4, not 1 out of 5. Your chances improve. I mean, your job is to get correct answers. It doesn't matter how you get there, right? Just Process of elimination, if you don't know, 50-50, that's a pretty good chance. That's better than 20% if you don't know any of them, right? Just use what you can. Your job is to get the most amount of questions correctly. So that means don't leave question blank. Don't try to do process of elimination when you don't understand it, okay? Going to the next one, they might throw some images at you, okay? So these images, they can get pretty complicated. They can get CT scans that you've never seen before. They can have MRIs. They can have anything they want. They can put a star next to this area and ask what the white stuff is. They can, you're studying histology. They can ask you anything about you covered, right? Don't get thrown out, but maybe you don't even need this image, right? Don't let the image divert you. Focus on what you know. And how'd you do that? Who is here, right? 49-year-old woman, right? She came to the physician, and now she has a 2-month history of abdominal pain, mild abdominal pain, nausea, severe episodes of vomiting, right? So that's why she came here. She's 49. Now, what does this question want from me, right? So which of the following is the most likely diagnosis? Well, this is a straight out, what is the most likely diagnosis, okay? So go back and read the question. Now you know what you're looking for. She's often feels full after eating, only a small amount of blood. She often feels full after only eating a small amount of food. I read blood. I was like, why? She's eating blood. And then it gives you goes to the physical exam, correct? Abdominal exam shows mild right upper quadrant tenderness, okay? And the liver is enlarged, 16 centimeters. Normal of the liver is 12, right? 8 to 12 is a normal. Get to know these normal findings are. They will throw at you some findings in physical. If you don't know them yet, look it up online, go over with your professors what the normal findings are, normal size of the spleen. How do they supposed to be felt on physical exam? They will be giving it to you on these tests, right? These are not written by your professors. Say, I don't know what the normal size of the liver is, right? Maybe I think 16 centimeters is normal. Maybe I think 20 is normal. So that's like smaller than usual. It's shrunk. So don't let it happen to you. So try to memorize the normal values. There's some really, and you can also, for the values of the labs, you can look it up during the exam. You can click on it and it'll show it to you. It's probably similar to your block exams. So going here, so they tell you that she's got right upper quadrant pain, right? And the liver is enlarged, and the ultrasound shows a 5x4 hyperechoic mass. Well, you may not know what that term is, but that doesn't mean that the NBME is not going to use it. They're going to use it, right? If you don't know, you don't know. You're at a test, okay? And there's no time for you to learn all this vocabulary. Just try to be okay with not knowing what the word means, because you may not need it, right? You know she's got some right upper quadrant pain. Ultrasound showed something that's 5x4 centimeters, and it's in the left lobe of the liver, okay? May or may not be significant. I don't know. So they look at this. So they take off the mass, okay? Does it matter if it was right upper quadrant? A lot of this is irrelevant, okay? Like if you came here and read, well, the mass was excised, and now they took a slice of it and they put some stain on it, and now they're showing it to you. Well, I mean, do I need to know what the pain is, blah, blah, blah? Well, I need to know what the slide is, right? That's all I need to know, I guess. And I know it's from a liver, right? And now you need to see, do I know this differential? Polycystic kidney disease? Maybe. So now is what you know, okay? And it comes down to, I think this one is correct answer is D, cavernous hemangioma. So it is not all about you knowing everything about each of these diseases, right? Sometimes you get bogged down with these words. By the time you get down here, you're so off and you think this is impossible and what's the point? And a minute and a half have gone by and you don't know what to do. You have to click or move on or run out of time at the end, okay? So learn how to be okay with, you're still learning the vocabulary. So learn how to be okay with not knowing all the words, because you won't, okay? I don't know all the words yet, okay? Let's go to the next one. And this one is the exact same question, but I just changed the image, right? So they say here in the image, they say that the abdominal pain, rapid cardiogenic span 16, and the ultrasound shows a 5x4 hyperechoic mass. The left lobe was the following most likely diagnosis. Well, now I only have is this. Maybe I memorized and it was based on this, okay? Now they gave me this. Maybe the differential changes, but they can. My point here is that you can even make flashcards with this image and see if this is cavernous hemangioma, right? But they can zoom in and they only show you like a piece. They can do whatever they want. They can do literally whatever they want. So be okay. If you don't know what this image is, don't let the ultrasound throw you off. You might not need the ultrasound, okay? Go back and read and say, what do I know about this, right? Rapid quadrant. Well, I know a couple of things, right? I've been studying this. So other thing that freaks out students, especially early on, is their graphs, right? Graphs, we hate graphs. I had a professor that taught us neuroscience in our 4th semester that she, I think, worked for the NBME at one time, and she said that they know we hate graphs. They know we hate math, and they know it, okay? And they put a lot of them there just to throw us off. A lot of the times, the question itself is easy, okay? Because you see a little short not even 2.5 lines long, but they know you're going to be thinking about this. Okay, that's going to be in the back of your head as you read this. Oh no, I have to interpret this graph, right? Well, when you come to a graph, a question like this is your basic pharmacology, bioavailability. I mean, take 5 seconds and say, well, what's on the y-axis? Well, it's plasma concentration of the drug, and x is the time, right? AUC there, area under the curve, area under the curve injected, oral. Well, I've studied some of this, and I see oral injected, so I see this formula correlates with this. Well, that took me about 10 seconds. I got 1 minute 20 seconds left. It's a short question. You can go there and read it, right? Highlight why you think it's important. Investigator comes studying 2 drugs, right? Drug X and Y determine which has a greater bioavailability. Well, I know that, right? Because bioavailability is right there. Healthy human volunteer and mechanisms of action, they have similar mechanisms of action. And if the drug X has a greater bioavailability compared to drug Y, which of the following is most likely to be likely to be greater for drug X than Y if both administered at the same dose? So basically, which one will be greatest? Is it the area under the curve? Well, what does the area under the curve represent, right? What is it, the beta? Sometimes they will throw in, even yesterday, I was going over with someone in an NBME question, and they didn't pick the correct answer because they wanted to pick, maybe this correct answer here is B. That's I don't know what the correct answer is. This is not the point of this session, right? I can't just sit here and review material. It would take too long, right? But as you look at this, they will throw in some questions like Emax. I mean, I've seen Vmax, Vmax on the Michaelis-Menten reaction. What's Emax? I don't know what that is, so I'm not going to pick, right? People think that and say beta half-life. What's the beta half-life? I know what a half-life is, but the NBME will throw in some weird words next to familiar words that make people not take them, right? And they're still correct, right? So pay attention. If every other question looks, other answer choice looks bad and you're sure it's not the correct one, you still pick the one that you think it is. It's usually the correct one, right? No, look at the graph. What on the axis? Okay, quickly take a look at the questions, and what are they asking, right? Is it going to be have the same? They say that they have the same mechanism of action, right? But drug X has a greater bioavailability compared to Y. So which the one is probably going to be greater for X than Y, right? So understand there, but actually look to see what's going on with the graph. It's not that the information is basic. Just don't be intimidated. Focus and ask yourself, what do I know about area under the curve and bioavailability? Because it comes down to knowing the basics. Okay, so this one is another one. They will throw in some images that might freak you out, throw you off. They don't care, right? This is a short little question that you can go and quickly read. I mean, what happened? A man accidentally touched the surface of a hot stove, and 20 minutes later, he has a blister develops on the site where he burned. Chemical analysis of the blister of the fluid is most likely to show the presence of which of the following, right? Basically, what type of response, right here? What's relevant here? What is the analysis will look here? What does it look like? Well, on the answer choices, I see histamine, IgE, interferon, gamma, interleukin 1, interleukin 2, right? Maybe you haven't had this stuff yet, but they might be in there. If it's one of the packages NBME, you might get a question that you have no idea what it is. Don't get upset, don't get mad. Don't let yourself get bogged down by one question. It's 160 questions, and you can miss a whole bunch of questions and still do well on this test. And remember, if it's completely foreign to you, it's going to be completely foreign to other people as well if you have done an okay job preparing. So don't let the images throw you off. Don't let unfamiliar topics throw you off. Just have a plan and move on, okay? Don't spend 3 minutes here because those minutes are going to cost you at the end, okay? Moving on here, they might throw you other images and they might throw you mechanisms of drugs, of action of drugs you've never seen before. Get back to the basics, okay? Who is here? Who is the patient? Well, it's a 46-year-old man. Why is this patient here, right? So this guy's here because, let's highlight what's important, right? He's here for wellness examination, right? You can run your eye through that first line and say immigrated from Mexico, comes with physician pre-employment, wellness examination. So this guy doesn't have any symptoms, okay? And then you want to know, well, what happened? What does this question want from me? Okay. Well, which of the following mechanisms of action of the drug responsible for these patients' findings? Well, I can't answer this question before I read it. I need to see what the findings are. What is a finding a key word for? Well, it's a finding on a physical exam. It's a finding on the labs, on images, right? So let's see what happened to him. He's from Mexico. He came from Mexico, and he's here to get a wellness exam. So they did a TB test on him, a tuberculin test, administered, and he develops a raised erythematous 12-millimeter lesion on his forearm within 48 hours. We've all done these to get in medical school, and you have to do it again when you're in clinicals. So this is the information you have to know. It's 12 millimeters an abnormal finding or is it a normal finding? Well, I don't know. Maybe I don't know. I haven't seen this yet. But what they're asking you is a basic information. So I might not need to know that. Okay. So 48 hours, he has 12 millimeters of this on his arm, and then they take an x-ray. So right now you can see, like, why would they do a chest x-ray on him? Well, that maybe 12 millimeters is abnormal. That's why they had to have another test. Well, x-ray in the chest shows no abnormality, and then he started on the recommended antibiotic treatment for latent tuberculosis. They gave you the so they gave you the diagnosis, right? They gave you the diagnosis. Right now, is anything that you read on the top relevant? Because they just gave you the diagnosis, right? Is it relevant that he had 12 millimeters lesion in his forearm within 48 hours and the x-ray shows no abnormalities? No, they gave you the latent tuberculosis was the diagnosis, right? Does it matter if he's from Mexico? Well, the diagnosis is latent, right? So let's not get focused on the things you don't know in these question steps, okay? Focus on what you know, because someone read those questions and thought it was appropriate for you to take them, then it would have been fair based on what they taught you, right? So now this patient has 4 weeks later, he comes up back to the clinic for follow-up, and then the hemoglobin is low, 9.3, right? Normal is like 13 or something, but you can quickly go on the labs and see what the normal hemoglobin is if you don't know that. Go alanine, they love describing labs by their full names just to throw you off. Alanine aminotransferase activity, well, that's ALT, right? It's one of the transaminases of the liver panel, right? Alanine aminotransferase, that's ALT, right? And L for AL for alanine, and that's 86, and serum aspartate aminotransferase 66. Well, that's AST, right? Aspartate aminotransferase. If you don't know if 66 or 86 is normal or abnormal, go in the lab, leave it open on the side of your screen. Your screen will shrink to half. Is it more? Well, it's a little bit elevated because normal, I think it's like below 20, depending where you're looking at those normal findings. But they had a photomicrograph on this, and they describe a photomicrograph. They took a picture on the slide of the microscope. Prussian blue, maybe you don't know what that stain is, right? Well, does it matter? I might know it by now. Do I know? If they're asking this, there's so many who know what the treatment for TB is, okay? So we should follow mechanism of action responsible for this findings. What do you need to know about this complicated question that you may not know what some of these stuff is? They want to know what the side of the mechanism of action of the treatment for latent tuberculosis. Okay, that's all they want to know. So don't get bogged down with the terminology. That's what you'll see when you learn to separate these and not get confused, let yourself get angry. I used to get very angry and even like talk out loud with myself during exams because I would get frustrated, like, why are they asking me this? I don't know this, right? But you don't have to know this, right? You need to know what is the treatment for tuberculosis, right? In your case, it may not be that. This is just an example. Even if you don't know what it is, the other stuff, it's fair to ask you this because they tell you what everything is, right? They tell the diagnosis, they told you, they're asking about the medication, right? Side effect or mechanism of action, whatever it is. So moving on, and I'll post a slide, these slides, so you guys have the answers for these. Okay, so I don't have to go through them. So this one here, and that previous one, there was only a one-liner. I took out the first one to show you the difference of when you only see the last question as opposed to the whole stem. But this one was exactly how the NBME had it. Like I didn't take anything out. Which of the changes in the cardiovascular system occurs with normal aging? Well, that's not a lot, right? There's no patient, there's no age, there's nothing. I mean, normal aging, what happens, right? Normal physiology, what happens when you get older? Well, here you have to go through these. You spent no time reading this, right? You have some time to go through these answer choices and see what looks good. Development of coronary atherosclerosis, does that atherosclerosis happen? Coronary atherosclerosis develops in everybody when we get old? It's possible, but I may not know that. So don't strike that one out yet. Develop of mitral stenosis. It's possible that some people get it, but is this a normal occurrence when you get older? Do you usually get mitral stenosis? I would say probably not. Okay. Read the next one. Increased basal heart rate. Well, do I know what basal heart rate is? Basal. Well, increased heart rate. Basal. Maybe I don't know what basal means, but it means it's increased heart rate. Does your heart go faster as you get older? Well, older people get really cold, that I know, because I think their circulation, you're not able to produce as much heat. Maybe this is not true. I'm just going with what I know. May not even be, maybe your grandmother, complains of being cold all the time and be like, well, your heart rate is high. How would that make you feel like that? Maybe that's the opposite of that, right? Increased basal systolic blood pressure. Well, older people tend to have blood pressure they're high. So that's plausible. I like D. I don't know yet. I got to read the other ones. Increased cardiac muscle mass. I mean, I'm not sure. I mean, I guess if you have hypertension and that's severe, that's not medicated, your heart is going to get hypertrophy. But does it increase in mass? That doesn't seem like. I like D better so far because I know for a fact older people get higher blood pressure. Increased compliance of arteries. Well, if older people have higher blood pressure, I like this one. If I'm assuming they're getting higher blood pressure, what happens when you get a higher compliance? Well, compliance is your vessels are able to adapt to a higher volume. So it complies to a higher volume. That means your pressure would go down. And when you get older, your body gets stiffer, right? And your arteries also get stiffer. So I think it's the opposite of that. So I'm doing this to show that you can just use common sense to answer some of these. Well, you know that older people have higher systolic blood pressure. Is it systolic? Do I know if systolic, diastolic? I don't know, but this looks like the best choice to me. And that's the one you should pick, right? Don't argue against yourself. Just pick an answer and move on. Usually it's the correct answer. So these are the most feared, this and graph, right? Most people, so many people get these wrong, even if they know the answer. They see the up-down arrows, they freak out, and they don't know what to do, right? So you don't have to do that because, well, let's read what's going on. Let's see what happens. Who is this patient? What is the symptom, right? What does he have? What does this question want from me, right? Highlight what you need. Well, this is a 34-year-old man. He's here because he's becoming lightheaded after 12 miles, running 12 miles of a marathon on a hot day, right? Well, what do I know about running marathon in hot days? Okay, I have an idea, right? Common knowledge. And which of the following changes in his autonomic nervous system is most likely here have occurred? Well, he's been lightheaded. He stopped at 12 miles of the marathon, and it's a hot day. Well, what is his vital signs, right? He's given here his tachycardic, it's over 100. And his blood pressure is 80/60. That's kind of low, right? Super low for a 34-year-old. Marathon runners, usually their heart rate is very low, 50. And some people even lower than that, like at normal. So 130 is very elevated for him, and 80/60 is very low. So what do I know about running in a hot day? Well, you may get dehydrated, right? You're losing all this fluid, and you're losing fluid. And how is your sympathetic and parasympathetic nervous system going to adjust to this high pressure, high heart rate, and low pressure? Well, the sympathetic is the fight or flight reflex, right? He wants to fix it. He wants you to continue running. Say from evolution, you're running from an animal. It has to kick in. You have to run, otherwise you won't pass on your genes to the next generation. People that couldn't do that, they didn't make it, right? So I know that perhaps the sympathetic nervous system, the sympathetic efferent, they love doing this. The sympathetic efferent, like they could have just used sympathetic nervous system, but they use efferent activity to throw some people off. Maybe they don't know what that means, right? They think it's something different than the sympathetic response. It's the exact same thing. What happens to the parasympathetic and sympathetic? Well, I know, try to find one that you know for a fact, because sometimes you're going to get these and there are 4 of them. Like say you have sympathetic, parasympathetic, sometimes they have 4 different categories with arrows, right? So you have to be aware when that happens and you become overwhelmed with all those arrows. Well, try to find something that you're sure of, right? Well, I know that the sympathetic nervous system increases. That I know, right? Well, you can keep this one's up, that one doesn't change, and that one goes down, right? These 2. Well, I mean, I can go from 3, 6, 1 out of 6 to a 50-50. These questions are actually easier than the other questions because you have a much better, statistically, you have a much better chance of getting it correct, right? So I know the sympathetic goes up, strike out all these other ones. Now you're 50-50. You don't know what the parasympathetic does. Maybe you don't know that, right? Well, do I know if it goes up or down? No. Then you pick one, right? Go with logic. Or maybe one increases, the other one decreases. I'm not sure. Well, then pick B, right? But don't sit here analyzing every error because only 2 of them go up. You get rid of the other one. If you know for a fact what happens to the parasympathetic, you pick A or B and move on. If you don't, you got a 50 chance of getting it right, right? So try that approach with the arrows. I think it's a very much less stressful way to immediately be overwhelmed, being these arrows or the graphs or labs that you don't know what they are. There's no time to find a normal range. Try to find out, like, what do I know for a fact that will narrow down your answer choices, and you can possibly get to the correct answer, right? It's just statistics. You have to get to pick an answer, right? At the end of the day, you're judged by how many answer choices you have it correct. It does not matter if you know it or you don't know it. So you have no idea what the parasympathetic does in this case. Well, if it goes up, they both go up, and you click on A, you get that credit. Nobody cares if you actually know it or not. Okay. So don't get bogged down. I think I have one more question. This is just to give an example of a question that is super long. this long question stem, very long answer choices, right? When you have questions that are single words or you can quickly glance through like this one, well, that's easy, right? But when you go like that, well, this is huge. I mean, say you only got a minute and a half to answer this. Well, take the same approach. Who is here? Why is this patient here for? And what does this question want from me, right? Go on and highlight and say, well, 39-year-old woman, she has multiple sclerosis, fine. And she comes here for follow-up examination. So she doesn't have, maybe not have symptoms right now, right? She's a follow-up. Don't read the rest yet. She knows you got a mass and she's here for follow-up. And then what does this question want from me? What should follow the most appropriate initial response to this patient, right? So this is a physician response. This varies a lot. I mean, we were even talking about this yesterday in a meeting that males tend to answer these questions more wrong than females because we think differently and they know this and they play with these answers. So first of all, why is this patient here? Well, she has multiple sclerosis. She's 39 years old, okay? And she's here for follow-up. Read the rest of the question. There's no way you can answer this. What are you responding to, right? You need to know what it is. So this one, you have no choice but to read this whole thing to see what's going on. Well, this patient, over the last 3 years, the patient has been hospitalized 7 times, acute exacerbation of the illness. She has not responded to the therapy and several disease-modifying agents. They'll throw in some of these, fancy-sounding words to, confuse you during these answers, especially the long ones. She has required at least 2 post-corticosteroid therapies every year. I don't know what that means, right? It's very specific to that specialty. She has seen several specialists and sought out experimental therapies. So she's trying a lot of things, right? So during this period, her disease has been rapidly progressing, and she currently requires a wheelchair. She's like deteriorating, right? And she's incontinent. So today she says that I'm not going to allow myself to hope because I will only be disappointed like I have been repeatedly, right? It's just frustrating, right, for her. So what's the point? No one in this system knows how to help me. Sometimes I don't even take my pills anymore because they don't help. And then the question wants to know, how do you respond to this, right? This patient is feeling hopeless, right? So find out what's going on. Like the trick for these is to not get overwhelmed. And some of these answers are going to sound very silly that you can spot them really well, really fast. So I said, I'm moved by your courage in the face of this senseless tragedy. Like, okay, courage just seems hopeless to me. I agree with you that further therapy is futile, and I'm going to recommend that we stop further treatments. I mean, really, does that sound fair to you? That's not what she means, right? That might not be correct. Some of them sound super wrong. While I completely understand your hopelessness about the lack of improvement, not taking the medication as instructed is only going to make things worse. This is kind of negative, judgmental, right? You only to the science. Of course, if you don't take the medication, it's going to make it worse, right? We know that, but she seems hopeless. She might be depressed. So the answer C says, I'm sorry to hear that you feel this way about your situation. With all that you've been going through, I can see why you would be so frustrated. I mean, that seems like a fair answer. Let's see the next one. You have been through so much, and I am so sorry. However, your attitude of despair could jeopardize your chances of improvement. Come on, you're being very judgmental. You can spot this one, your attitude that's very judgmental. That's usually not the correct answer. Although you will hear some doctors at the clinic saying the exact same thing that you're reading here. And then the next one says, I understand how your illness would make you angry. I mean, she doesn't sound angry, right? I mean, you don't know she's angry, right? She's kind of frustrated. Angry, apparently your previous doctors did not know how to help you handle the condition well, but I believe I can help you. Well, I mean, what do we know about multiple sclerosis, right? There's no cure. So how can you make false promises like that? You don't know that. They had this for 3 years. I mean, even the beginning is wrong. They're making you angry, and then you're being judgmental of the previous doctors. This one is the worst one. And then the last one says, I'm concerned that this terrible illness, I mean, this is very negative, isn't it? Terrible illness may be affecting your capacity to make decisions for yourself, and would like to refer to a psychiatrist. Yeah, that seems wrong, right? That seems super wrong. So just these questions, the point is, they will throw you a long stem and they will throw you long answer choices. And you'll be like, there's no way I can make a call. A lot of people just end up just moving on because of time. But if you're taking the approach of always knowing what to look for, you will have plenty of time. I know people that I've been working with, they finish NBME with 30 minutes to spare in each block. So these questions are all about how you read. Of course, some people read faster than others, but this is all about how you read and how you let these questions affect your mental state during you sit for these tests. When you come to these questions and you see something that's frustrating to you, maybe you've been worked up for the last 10 questions that you weren't sure what it was, and then you come up to something like this, you say, well, there's no way I know this. There's no time. You got 5 minutes left and there's 6 questions to answer. Well, you end up picking one that's not the correct answer because you don't have time to answer it. So my point of this is, I'm going to be continuing to do this through to the end of the semester, and I'm going to choose different ones. It would be nice if you guys would come to the live sessions so we could have a discussion, but the video, I'm fine doing the video if that's what's better, but I think you guys have to get on this like fast, because answering 160 questions, and I don't know if they're going to give you a break in between, maybe not. That's 4 blocks of 40. That's a lot of questions, okay? And I think if you guys started to really start to dissect these questions and learn to have your mental state ready to deal with words you don't know, right? Images you don't know, and because they're going to throw it at you. You will be set to not only this exam, but all the next exams that you have. You have exams from the NBME from now till the end, to the last day of residency. You're going to take a board exam for that specialty, and there's going to be an NBME test. Okay, so there's no running from this. If you're going to be a doctor, you got to know how to answer NBME questions. Okay, I know you guys must be frustrated that you need to memorize a bunch of details. That needs to be done as well. But I know a lot of people who do well on memorizing. You can quiz them, you can ask them about the material, they know it, but when it comes to answering questions, especially at a timed environment, they cannot perform. Okay, you have to be able to perform under pressure, and the time limitations to do well in these tests, unless you of course have a perfect memory that you can just read it and remember it. Okay, so next week I will talk about how you can take, there's so many of these questions on the internet, on our drive that you can take. You can ask your upperclassmen, they might know where it is. Okay, they might have it on their own, on their flash drives, on their hard drives. Ask them, talk to people and say, how do you answer NBME questions? How do you practice? Like, you have to start doing this, start asking questions, bring some of these questions, bring it on your iPad, go over on office hours with your professors, right? I used to do that all the time. Bring 4 or 5 of these questions that you might find it interesting or difficult, that you had a hard time answering. Well, take a screenshot, put it on your iPad, or print them out on a piece of paper, bring it to office hours, have your professor go over it with you, right? Break this down, and they might even think like, hey, this is way over your pay grade. Don't worry about something this complicated, right? You don't know, right? Just be proactive with these questions. Don't let it catch you off guard, because these final exams are being NBME. They bring a lot of people down, and it's all about how you prepare. It's not all about memorizing material. Okay, you guys have a good week. I think I might do one of these sessions during the week and post it, because next week is Thanksgiving week.